Hey, you guys. So today is March 28th, 2020. Live in Brooklyn, New York. And here's what's happening today in terms of COVID-19. So the infected number in New York City is now at 29,158 people. And in the U.S., it's 120,204. We have far exceeded China and Italy in terms of infection rates. The deaths in New York City are now at 517, and in the U.S., the deaths are 1,997. In terms of New York City, in terms of the spread of infection rates, Queens is being hit the hardest. There's 5 boroughs in New York City for you guys who don't know. My bad. There's Brooklyn, Queens, Staten Island, which don't count, Manhattan, and the Bronx. And so the hardest hit right now is Queens. They have about 9,000 infected with 120 deaths. Then Brooklyn is next with about 8,000 infected with 80 deaths. And people are kind of speculating about why that is. Part of it is that Queens, I think, has quite a high Asian population, and so does Brooklyn. And also the population sizes are pretty large there. The Bronx is the third next, I believe. But I feel like that's because of some racism in there, because the Bronx got mad people. And a lot of them actually have things like asthma and emphysema due to structural racism and factories and manufacturing and all that other shit there. So I expect that those Bronx numbers are inaccurate. In terms of population, so yesterday I had talked about how one of the highest rates of population are in the NYPD. So today's numbers, there are 500 employees, NYPD employees. That includes like police officers and like civilian staff who are like secretaries and that sort of thing. 500 of those people have been infected with the virus, which is about 1 in 80 NYPD staff. And which is about 2% of officers. And another 4,000 called out sick on Friday, which was yesterday. Now that doesn't mean that they actually are infected, but they definitely called out sick. Ambulances in NYC are as busy as 9/11. I believe that they were at, on average, they said it's about 4,000 calls that they get to the dispatch centers, but it's about 7,000 that they got on Friday. And EMS, which is the ambulance people, are having to decide who to take to the hospital and who not to take to the hospital in New York City because the shit is just so packed. And speaking of that, state people in other states are also having to decide like who gets care, who doesn't get care, which is brazy. So like in Alabama, state officials released like a best practices sort of manual, and this is a direct quote. It says, people with severe and profound mental retardation or moderate or severe dementia or severe traumatic brain injury are unlikely candidates for ventilator support. And in Washington State, some of the parameters that they're saying are that people who have a loss of reserves in energy, physical ability, cognition, which is like brain shit, and general health should be sent to like outpatient or like palliative care. And so that's just a couple of states who are doing that, which is discrimination. That's discrimination. You cannot deny medical care to people based on their mental state and their physical state. That's illegal. And I'm worried that in places, everywhere racist, we all know that. New York City's racist as fuck. But in places like with blatant racism, aka the South, the Midwest, I'm really concerned about who's being turned away from care. We all know that marginalized groups are not getting it, but are not getting care. But are they going to be turning away Black people at the ER? Are they going to not send out ambulances to Latino families? So think about it. What else is happening? Last night's weather in NYC on Friday was bomb as fuck all day long. I went outside for like 2 minutes. It was pretty warm. I think it was 64 degrees or something like that yesterday, which is warm in New York City, okay? People were buck wild outside. I could hear people like outside in my neighborhood outside. And so apparently so many people were out in parks and things yesterday that New York City officials are weighing a decision on whether or not to impose like $500 fines on people who are not doing social distancing. Because people, like I said, are in droves in parks, but also a few places of worship, churches and synagogues probably are Well, I guess if it was Friday, synagogues, Fridays, lots of Hasidic Jews in New York City, Friday is like their Sunday. And some of them still had services. Even though we're in this stay-at-home order, which they're not calling a stay-at-home order. Interesting tidbit, 7 out of 10 Americans are currently in some sort of stay-at-home order, and that's including across all the states. This morning, Trump went on the news and said that he's considering imposing a forcible quarantine. By forcible quarantine means that the cops, can get involved. On the tri-state area. The tri-state area is New York State, New Jersey, Connecticut. And that's because we have like the highest, New York State, New York City in particular, has like the highest infection rates across the nation. And so Trump is saying that he wants to basically keep all of us in the house. And a few minutes after he said that and went on air and said it, Cuomo, our governor, came and said, hell no, that's not happening, that's unconstitutional and illegal. But Trump is not the only one who's thinking that. There are several states that are kind of putting people who visited New York City and who are residents in that state or who are from New York City and who are like going to visit there are instituting some sort of quarantine rules. And that includes like Rhode Island, Texas, Florida, Maryland, and South Carolina. Rhode Island is actually having the National Guard stop New York City license plate cars on the road to stop them, which Cuomo is also really upset about and is saying that that's unconstitutional. Experts are saying that they may be reconsidering that mask rule. So for those of you who don't know, they were saying that in terms of wearing masks, that it's not as effective if you are not symptomatic or if you're not interacting with anybody who has symptoms or who is positive for coronavirus. However, this article that I read that I'll be posting said that a lot of medical experts, scientists are saying that because the infection rate is so high in the US, that there is likely that there are way more people who have it than are testing positive, and that because there's so many people who potentially have it, that people who are not infected and who are not interacting with people who are known to be infected, or I should start saying known to be infected, because we don't know shit, okay? They're not testing us, so we don't know what we got. But they're saying that everybody should be wearing it, and they're debating that, about whether that's the way or not the way, because we don't got no more masks. Where the masks at? I don't know. So that's what's happening in terms of like bad news. I want to tell you guys some good news because it's not all bad. So in terms of good news, New York City, the Javits Center, where they were doing that makeshift hospital that I talked about the other day, is done. And in fact, they have 2,910 beds in there. It's being staffed by 350 medical personnel from FEMA and the Army. That will be up and running on Monday. The Comfort ship, which is the one from the Navy, will be here on Tuesday, and it'll be 1,000 beds on there. And both the Javits Center and the Navy ship will be used for non-COVID medical emergencies, which a lot of the hospitals in the area are saying that that's what they need, is for non-COVID people to go there. And so people in the hospitals now who don't have COVID-related concerns, they're going to start transporting those people starting Monday to the Javits Center and then Tuesday to also the Comfort Navy ship. De Blasio, our mayor, is asking for the federal government to give us more permission and supplies to build makeshift hospitals, one per borough. Places where they're looking at is the Brooklyn Cruise Terminal, which is near my house. The Aqueduct Racetrack, which is in Queens, shout out Queens. CUNY, which is that's like our public college. CUNY, Staten Island, a campus in Staten Island, and the New York Expo Center, which is in the Bronx. So hopefully we get permission for those soon. De Blasio is also working with state officials to freeze rents for the rest of the year. I hope that go through. And the New York presidential primaries have been moved from April 28th to June 23rd, which is amazing. More good news is that people are being amazing to each other. I'm seeing a lot of things online about people who are not sick, shopping for people who are sick or who have compromised immune systems, or the elderly. Beautiful. I've seen a lot of things online about people organizing and donating to get supplies to the homeless and that sort of thing. I've seen a lot of people getting in celebrities and government's ass, which is so great for me. I feel like a lot of people are getting more woke because we're seeing all of this bullshit that's happening in response to coronavirus, and how the blatant discrimination of resources and allocation of resources and all these other things, how widespread it is. and how it's really impacting all of us and not just the poor who we don't like. Okay, let's stop acting like that. We know America hates the poor. I don't have any problem personally, but we know America hates the poor. Stop lying, okay? And that's why they treat the poor that way. Doctors are doing research super quick. They can't lie to us anymore about that because scientists are coming through with these coronavirus updates hella quick, okay? So they can't stop lying about that. Yeah, so those are just some good things that I'm seeing. The breakdown of the capitalist structure in America, seeing that breakdown has been filling my heart with joy. Seeing people being let out of jail, the prison industrial complex breaking down, filling my heart with joy. All of that is filling my heart with joy. These blue-collar workers, proletariats, protesting. I use proletariat. I am not a communist, but I know the lingo, okay? I'm not a comrade, but I'm a supporter. Yeah, so those are just some good things happening. These videos are shorter. Hopefully I can try to figure this shit out with editing. If anybody knows how to do it, let me know. My man knows how to do it, he said, and I would love for him to help me. I'm actually going to take him up on that offer so I can make these videos, I guess, a little bit cuter. I don't know. Yeah, so that's what's happening in New York City with Corona. My hair bundle came out. That's okay because I'm still cute. I love you guys. Please stay safe. Stay your ass in the house. Wash your fucking hands. Start wearing a mask. I posted this thing on my Facebook. I'll post it on other things, I guess, about homemade mask wearing. Better safe than sorry, bro. I posted this thing on my Facebook of this couple wearing like pads on their face. I wouldn't do that, but you know, times is rough, bro. Whatever you feel like is going to keep you safe and keep your community safe, go ahead and do it. I love you guys. Shout out to my mom. She's amazing. She's really funny. I wish that I could have her on, but she don't live here. Love you guys. Stay safe.